Good evening, everyone. Good evening, good evening, good evening. Legal procedure and law and inquest. So, in yesterday class, we discussed one very important topic, and in today's class, we are going to discuss about inquest. What is inquest? Types of inquest, best inquest, police inquest, and some video-based question today. Yes, am I audible and visible, guys? Yes or no? Good evening, Menak Datta, Rakesh. Namaste, Advi. Yes. Shall we start? Advi, Menak, Rakesh. Yes. Okay, fine. चलो स्टार्ट करते हैं. इनक्वेस्ट मतलब क्या होती है? टाइप्स ऑफ इनक्वेस्ट क्या है? पुलिस इनक्वेस्ट क्या होता है? ऑल दिस आर वेरी कॉमनली आस्क्ड 5 मार्क्स क्वेश्चन. इनक्वेस्ट मतलब याद रखना, इंक्वायरी टुवर्ड्स cause of death. Like in case of hanging, the cause of death is asphyxia, drowning, asphyxia, bone injury, septicemia, organ of phosphorus poisoning, respiratory paralysis. So, inquest in general, inquiry towards cause of death. Not only cause of death, sometimes manner of death, or to identify the dead body in unknown cases, or the weapon that is used. So, what is the weapon used? What happened? What is the cause of death? Where happened? What was the probable motive? Like this. So, inquest generally done to find out the cause of death. याद रखना पड़ेगा. ठीक है अरशद अली, चलो हेल्प करते हैं. चलो ओके. इंक्वेस्ट इंडिकेशंस क्या है? सबसे पहले है सडन डेथ. Any sudden death, if you have any suspicion, if it is unnatural condition, then the postmortem is required. It can be medico-legal case. So sudden death can happen due to anything. It can be due to some vasovagal inhibition, or it can be anaphylactic shock. It can be occlusion of coronary artery. So anything that can lead to sudden death, the inquest is done usually. So if it is a natural condition, then inquest is not required. Like example, person dies as a result of heart attack. The inquest is not at all required. Then suicide, homicide and infanticide. Suicide, as you know, hanging is the commonest cause of suicide. Homicide like firearm injury or blunt force trauma, sharp force trauma, or homicidal poisoning and all. Infanticide. What do you mean by infant? Can anyone answer? Infant मतलब क्या है? Infanticide is equal to murder. What do you mean by infant? Very simple question, guys. So options are 1 month, 6 months, 12 months, 5 years. What do you mean by infanticide? Death of child within 1 year. That we consider as infanticide. So it can be female feticide or female infanticide or some unwanted baby, or many causes are there. Even infanticide inquest is done to find out the cause of death and also to find out the viability, whether it is live birth or stillbirth, like that. Okay? Up to 20, less than 1 year. Yes, Advi answered very good. Alka answers are less than 1 year, है ना? So basically known as infanticide. So infanticide in India is equal to murder. That is 103 BNS, guilty mind and guilty act. ठीक है? Okay. Then accidental death. So like in case of 304 AIPC, or now it is 106 BNS. Road traffic accident. Inquest is done. Anesthetic death. So it can be again medical negligence, 106 BNS, can be gross medical negligence. In that case, inquest is done. Then medical negligence, I said already. Custodial death. In custodial death, in police custody or in psychiatric hospital, so the custodial death, the inquest done is the magistrate inquest. Dowry death, that comes under 80 BNS. So all of you write in the chat box, dowry is equal to 80. You can remember how much is the dowry? 80 lakh dowry. So 80 BNS, the punishment is minimum 7 years of imprisonment up to life imprisonment when there is a death of the female within 7 years of marriage. So all of you write in the chat box. So just write dowry is equal to 80 BNS. Just type. So dowry is equal to 80 BNS. It's a very important MCQ. Okay, good. Rakesh Menak Datta, that's great. Now, what are types of inquest? Types. So there are many types. In India, we have only two types. एक है police inquest, दूसरा है magistrate inquest. So types हैं. So there are 5 types. The first one is the police inquest. The second one, magistrate inquest. The third one, which was there in India for some time, coroner inquest. The fourth one, in fact, best inquest, medical examiner inquest. And the last one, procurator fiscal inquest. So there are basically 5 types. So in India, the best type is police, that is magistrate inquest. The most common one is the police inquest. And again, there are some MCQ guys. The best inquest in the world, that is medical examiner inquest, because he is a dual expert. He is a forensic expert and also the pathology expert, legal expert as well. So he's going to do the crime scene investigation, at the same time post-mortem also. The best is the medical examiner, that is followed in US. So medical examiner is the best. It is followed in US and Japan. Procurator fiscal system, it is followed in Scotland. Coroner, it was there in India, in Mumbai and Kolkata for some time. That is, I think, up to 1999, it was there. So now it is abolished. Now it is not there. There is no coroner inquest. So we have only police and magistrate. Yaad rakhna, police is the most common one. Any unnatural death in India, the most common inquest done by police only. The magistrate is the best inquest, usually executive magistrate. So that is the best in India. Try to understand this. Menak Datta. And one more important MCQ, police inquest comes under 194 BNSS, magistrate 196. So police, all of you write in the chat box, police is equal to 194. लिखो in chat box में लिखो. Magistrate is equal to 196. 196. याद रखना पड़ेगा. Police 194, magistrate 196, BNSS, Bharatiya Nagarika Suraksha Sanhita. Very, very important point. Now चलो दिखते हैं आगे. What are indications for magistrate inquest? So what are indications? याद रखना, इंडिकेशन है 3 कॉमन इंडिकेशन है. एक है DDD है, D मतलब that is dowry death. Dowry death. D for digging out, that is exhumation. D for custody death, so death in custody. So it can be custody of police officer, the custody of jail, or death in psychiatric hospital, like example schizophrenia patient. So D for dowry death, D for digging out, that is exhumation, and D for that is death in custody. So there are basically three indications है, 3D बोलते हैं इसको, ठीक है, 3D. Okay, yes, Rakesh Manak Datta. So that's great. So all are answering, that's great. I'll repeat again, there are many MCQ. Inquest मतलब inquiry towards cause of death है. There are 5 types हैं. Best inquest है medical examiner, best in India है magistrate inquest है, most common है police inquest. Police inquest आता है धारा 194 BNSS और मैजिस्ट्रेट इंक्वेस्ट आता है 196 BNSS में. 3D याद रखना पड़ेगा. D मतलब डॉरी डेथ है, D फॉर डिगिंग आउट है, डेथ इन कस्टडी है. सो डॉरी डेथ इज इक्वल टू 80 BNS. सडन डेथ, द मोस्ट कॉमन कॉज इज कार्डियक कॉज. सो इट इज डन इन अननेचुरल कंडीशन, नॉट इन केस ऑफ नेचुरल कंडीशन. और एक और याद रखना, 106 BNS इज एक्सीडेंटल डेथ आर ड्यू टू मेडिकल नेग्लिजेंस. सो समझ में आया होगा आपको? यस गाइस, इज इट क्लियर? बार बार पूछते एग्जाम. मैंने दत्ता, राकेश, are you okay? So this can be a 3 marks question. Now police inquest. So what is police inquest, the how police inquest is done, and all we are going to discuss in next 5 minutes. Say yes or no? Yes, Rakesh is telling you yes sir. Yes, we are done with this. चलो ठीक है. Now you need to identify, there are 4 indications है. Just identify what are the 4 indications. A क्या होता है बताओ, B क्या है, C क्या है और D क्या है. All these are indication for magistrate inquest. देख के बताओ, just for a fun, just try and answer. ठीक है, मैनक दत्ता, राकेश, try. So the first one here is the doctor and patient, probably death in a psychiatric hospital. एक psychiatric patient है, psychiatric hospital death. B क्या है, dowry death है. So you can see here rupees and all, and a female there, female in the hand like this. So dowry death. And here it is probably death during police firing. Police firing. और C क्या है, exhumation है. So याद रखना पड़ेगा. ठीक है? Yes, good. That's great. हो गया. Now police inquest. So briefly about police inquest. Police inquest means usually sub-inspector or sometime above the level of sub-inspector like circle inspector, DYSP and all. 194 BNSS में आता है unnatural death. Any unnatural death in India, maybe suicide, homicide, ragging death or murder. In all these cases, so police inquest is done. Usually by sub-inspector. Sub-inspector मतलब investigating officer. So IO बोलते हैं. IO याद रखना in forensic. IO मतलब investigating officer. So what he will do? He will go to the crime scene. He will do the inspection. Then he will inform nearby executive magistrate. He is going to inform Tehsildar or assistant commissioner or deputy commissioner. Then he will do the formalities. So the first step, information goes to executive magistrate. Executive magistrate मतलब Tehsildar or ACDC like that. इसके बाद he will prepare Panchanama. He will talk to the neighbors. He will talk to the witness. Pancha मतलब 5. So statement from the 5 people is known as Panchanama about the type of weapon, what was the weapon that is used, whether it is some firearm, whether it is some sharp force trauma, blunt force trauma, or some head injury, fall from height, accidental death, anything that is. So, or hit and run case, so like that. And the manner of death, possibly manner of death. So manner can be suicidal. So in suicidal, we will see, we will get suicidal note. Homicide, we will get some revenge, some weapon there, some fingerprints there. We call it as corpus delicti. Then it can be accidental death, like example, road traffic accident, or autoerotic hanging is one example for accidental death. Harakiri is a suicidal stab wound. In terms of witness, so witness usually common witness, eye witness, बोलते हैं eye witness. So statement from the 5 people. ठीक है? Yeah. चलो. Then he will request for the postmortem examination, autopsy examination, produce inquest reports. So once you get a requisition inquest reports, as a doctor, as a forensic expert, postmortem करना जरूरी है. Postmortem करना है, external examination, internal examination, weapon examination, and you need to give provisional opinion and final opinion about the cause of death. Then IO has a power to summon the person. IO is there, no? Investigating officer. He has a power. He can summon anyone, even doctor also. So as per section 195 BNSS. But याद रखना, police inquest, the police cannot issue warrant. The warrant can be issued by magistrate only, usually judicial magistrate, not by the police. So that's why we say magistrate inquest is best. In fact, it is very superior than the police inquest. याद रखना पड़ेगा. Best है magistrate है, most common है police inquest है. So this is about the police inquest. This can be a 3 marks question. So any doubt in this, guys? If you have any doubt, you can ask me. Menak Datta, Rakesh, yaad rakhna padega. Everything is important here. This line, one by one, you need to write in the exam. So this is how you need to write to get good marks in exam, especially distinction mark. Okay? Chalo, ho gaya? Menak, Rakesh. Now let's see one case. Any doubt? No doubt. Okay? Look at this case. Now this is a case of unnatural death. What do you think? So what is the probable cause of death in this case? So here around 40-year-old. Okay? I'll give you the brief history. So I'm going to write here. 40-year-old male hai. Found dead near roadside. Near roadside. Somewhat rainy season. The rainy season. And he was chronic alcoholic. So he used to have a lot of alcohol in his life. So chronic alcoholic hai, roadside, बड़ा है body, 40-year-old है, male है. क्या हो सकता है? ये क्या murder है? और look at the slippers. Slippers are intact. You can see here the slippers are intact, but here there is some tear is there over the cloth. You can see the tear. And look at the plastic bottle here. I think here some plastic bottles are there, some plastic papers are there, mud is there. इसमें है mud है, ये सब है इसमें. क्या हो सकता है? मेनक दत्ता. And further examination देखो. This is trachea. In the trachea, what you can see here, froth. Froth hai. And further examination, you can see here, there is a congestion of the face. Congestion of face, petechial hemorrhages, petechia hai, and cyanosis hai. And there is a clear line of demarcation bhi hai. Okay. On further examination, lungs are congested and blood alcohol level around 200 milligram percentage. blood alcohol level 200 milligram percentage. Now all of you just let me know after this finding. Once again, I'll repeat. So this is the crime scene photo. Trachea showing froth, congestion, petechiae, cyanosis है, lungs are congested है, no injuries on the body है, blood alcohol level 200 milligram percent है. So rainy season है, mud है. So what is the cause of death or what is the probable manner? Now you are expert, you need to answer. चलो चलो बताओ ये क्या हो सकता है? Is it drowning? So some are telling drowning हो सकता है. Drowning बेटा ये पानी इतना नहीं था, but he was fully drunk and rainy season. Probably he fell down and he was unable to get up from that position. So because of the alcohol, and it's probably a combination of drowning and also positional asphyxia. So the cause of death is clear, that is asphyxia. I think it is positional asphyxia, not the drowning. So that is the best answer. It's not fall from building, no history nahi hai, fall from nahi hai. Answer hai, this is basically positional asphyxia hai. Positional asphyxia, and the manner is accidental. Accidental. And also associated with drunkenness, high level of alcohol in the body. So this is how the police investigation is done. Okay? Yes, guys. Fall from some murder, murd. Achha, theek hai, good. Beta, good. Alka Kumari, that's great. Asphyxia to positional asphyxia and dry drowning, manner of death accidental. Good. That's great. बहुत बढ़िया, बहुत बढ़िया. Now, how many of you in favor of murder? How many of you in favor of murder? Look at the crime scene. The crime scene, no injuries on the body. No injuries, no abrasion, no bruise, no laceration, no incise wound, no stab wound. Look at the slippers, slippers are intact. Look at the cloth, it is not disturbed. So this is how the police inquest is done. So the postmortem examination is a part of police investigation in case of unnatural death. Rakesh, Alka Kumari. Good, Manak. Is it interesting, guys? Like this, shall we conduct some cases like this every week in forensic from next week? Some interesting cases, around 10-15 minutes, 30 minutes talk. So this case hai, kya findings hai, cause of death kya hai, like that. So we'll discuss generally in upcoming classes. We are planning something like Forensic Friday or something like that. Okay? Yes. That's great. ये हो गया. Now review question. So last 10 minutes. So guys, review questions hai. Now today I introduce some video based questions. So all are very, very interesting questions, and you need to write the question number and the probable answer. Okay. So then we'll have discussion. I'll give you around 15 to 20 second time. So maximum 15 to 20 second time. Yes. Ready? Yes. ठीक है, चलो हो गया. Now look at this case. So this is a case. Now go through this video and try to identify primary transportation injuries caused by. Here is a case of road traffic accident. A child, I think 5-year-old, accidentally hit by the moving car. So probably around 40-60 kilometer speed. So question है primary transportation injuries caused by. Option है vehicle है, mirror glass, road surface, all the above. So याद रखना पड़ेगा आपको, आंसर करना पड़ेगा. So there are 3 types of injury है. एक है primary, secondary, then secondary injury, सो प्राइमरी इंपैक्ट बोलते हैं इसको, सेकेंडरी इंपैक्ट इंजरी एंड सेकेंडरी इंजुरीज. So primary impact injury, secondary impact injury caused by the vehicle. In general, vehicle only. So it can be car, bus, truck, whatever. Secondary injury that is caused by the surface. So surface, that is road basically. So like brush burn and all. So primary impact injury, the most common site usually legs. But in children, it can be trunk also. Again, depends on the height of the vehicle, height of the bonnet, and height of the child. So most commonly in adults, it is the legs. So probably that the fracture of lower end of femur, dislocation of the knee joint. So we call it as primary impact. Secondary impact, again because of the vehicle, the common site of injury usually back, sometimes head injury also. So secondary injury because of the fall on the surface. It can be graze abrasion, whatever it is. Again, by looking at the injury, you can give idea about the speed of injury, the speed of the vehicle, whether 30 km speed, 60 km speed, 90 km like that. By looking at the severity of the fracture and the distance between the vehicle and the person, and the force of throwing away the person from the crime scene. So all this depends actually. So answer है इसमें vehicle है. So answer is vehicle, good answer. So the answer given by Rakesh and also by Menak Datta. Menak Datta, good. And also by Alka Kumari. Okay, next. Now look at this again, a movie scene hai. Which of the following considered a sure sign of antemortem hanging? Look at the video there. It seems to be hanging. The person is alive. When person is alive, when victim is alive, we call it as antemortem hanging. So it can be suicidal, it can be homicidal also, accidental also. But whether it is antemortem or postmortem, so it depends on the findings. ठीक है, so इसके देख के बताओ ये क्या finding है. Which of the following ligature mark, dribbling या hypostasis fracture? So answer is very simple. Whenever antemortem hanging very important feature is dribbling of saliva. So one of the surest sign of antemortem hanging. So answer क्या है? Ligature mark. No Rakesh, it is not ligature mark. So ligature mark is oblique in hanging. It is horizontal in case of strangulation. It is not ligature mark. Hypostasis, no. Hypostasis is normally seen in the dependent body part. If a body is hanged for more than 6 to 8 hours, it will be on the lower limbs. So if body is removed immediately after the happening, then it is usually on the back of the body. Fracture of cervical vertebra, no, that is in case of judicial hanging. So answer है dribbling of saliva. B is the correct answer. B. That's great. Okay, next. Now look at this case. Sudden death of a bus driver while driving. Which artery is most commonly occluded? So options है left coronary artery, right coronary artery, left circumflex artery and coronary sinus. So coronary sinus basically venous drainage, not the answer. Left circumflex, right coronary, okay, but the most common we call it as widow artery, that is left coronary artery, we call it as left entry descending artery. LAD is the answer. ठीक है? So answer है widow artery. So all of you write in the chat box, widow maker artery. LAD. Keep writing this. Manak Dutta, no, your wrong answer. It is wrong. Good. हो गया. Third question. Now fourth question. Are you there? Okay. Now look at this very interesting question. So this question is from a movie. ठीक है. Vitriolage or acid attack is punishable under which section of Bharatiya Nyaya Sanhita? Option है 124, 116, 103 and 106. Try this and answer. So 124 is the answer. Correct. Many answered correctly. Answer है 124. 116 grievous hurt है. 103 BNS is murder है. 106 is basically that is medical negligence. So answer है 124. So 124 is the answer. That is basically vitriolage. So all of you write 124 is equal to vitriolage. So vitriolage can be due to acid or it can be due to alkali. Okay? So it is usually involves oil of vitriol, that is H2SO4. So acid causes coagulative necrosis. Except hydrofluoric acid. Alkali causes liquefactive necrosis. ठीक है? Yes guys? Okay, good. चलो आगे देखते हैं. Next question है fifth question. In fifth question there are two snakes are there. You need to identify both are poisonous snakes हैं. In one snake we have hood. Other snakes you can see triangular head. Try to answer this. So the answer is, one is common cobra, the second one is Russell's viper. Common cobra is basically neurotoxic है. Russell viper is hemotoxic. Okay. So there are big four snakes in India. Common cobra, common crate, Russell viper, Saskade viper. The treatment is anti-snake venom. Okay. So answer is good. Rakesh, Manak Datta. Yeah, first to answer by Mr. Rakesh. So excellent answer, Rakesh. You are doing excellent job today. Very good. And also Manak Datta. Now look at this plant and try to answer. So there is a poisonous plant which is given there in the video. that is an organic irritant that is used in criminal abortion. So what is this? Try to identify. You can see here the plant, the thick leaves are there, very common plant in India. Sometimes the flowers are pink or purple, sometimes it is white also. Okay, alba and gigantea. What is this plant which is commonly used in criminal abortion and also used in artificial bruise and sometime in infanticide also? Criminal abortion, artificial bruise, infanticide, it's organic irritant, so it can be used in case of some murder also, but it is not very common. What is this? ये क्या है? Rakesh got the answer. So this is basically Calotropis. Calotropis. So याद रखना Calotropis है, एक्टिव प्रिंसिपल है कैलाटॉक्सिन, कैलाट्रोपिन and gigatin, so which is used in criminal abortion CAB and artificial bruise. Criminal abortion is punishable under 88, 89 and 90 BNS. So very, very important and very commonly asked in the exam. So it's a organic irritant. It is not cardiotoxic beta, it is organic irritant. So now the next one, look at this plant. This plant is again organic irritant, very, very poisonous plant. The active principle is ricin, which was used in umbrella murder case. Once it enters the body, it is going to kill the person by causing hemorrhages, brain hemorrhages, kidney, liver hemorrhages. The fatal dosage is around 10 seeds. The fatal period is around 3 to 4 days. Very famous case of Marco death, umbrella murder case. So now I think you got the answer. What is this? Try. Raghav is telling 666. ये क्या है 666? ये है, that is castor plant. Active principle है ricin. Fatal dosage 10 seeds. Fatal period 3 to 4 days. It's a organic irritant. And the seeds are shiny. Okay, याद रखना पड़ेगा. Very commonly asked viva question. And these seeds, the fruits occur in clusters. In datura it is single, but in castor it is clusters. Answer है? Good answer. Good. Richness common is good. That's great. Then, now look at this asphyxial death. Here is a type of asphyxial death. Constriction of neck in elbow bend or knee bend, leading to asphyxia and venous congestion. Okay. Again, there are two types are there in this method. What is this method known as? Try and try. So this is a very famous method of strangulation hai. This is known as mugging, or we can say choke hold, or carotid sleeper hold. This is a type of strangulation. Strangulation type है, ठीक है. Strangulation can be like HH strangulation, manual strangulation, mugging, burking, mugging, and garroting, Spanish windlass and all. Burking basically that is comes under suffocation classes. The cause of death in simple, it can be carotid artery occlusion, or it can be vasovagal inhibition, or it can be venous congestion. In general, it is asphyxia. Asphyxia means combination of hypercapnia and hypoxia. So याद रखना पड़ेगा, very very important है, बार बार पूछते एग्जाम में, ठीक है. मैंने दत्ता, that's great. Then the ninth question. Ninth question is very interesting question, guys. You just try this. जो डर गया समझो मर गया. जो डर गया समझो मर गया. जो डर गया. So here is a case of enacting of sudden death while having alcohol along with a banana. So we call it as banana syndrome. When banana which struck in the larynx, which stimulates recurrent laryngeal nerve and superior laryngeal nerve, which causes vasovagal inhibition and death. So just to tell you something known as basically cafe coronary syndrome. I think many got the answer. So cause of death क्या है? Vasovagal inhibition. And again question can be asked, how to differentiate between choking and cafe coronary syndrome. In choking, you will see classical signs of cyanosis, petechial hemorrhages and congestion. But in case of cafe coronary syndrome, there is a sudden death. All these signs are usually absent. It's very common in alcoholic person, usually middle age to old age, under the influence of alcohol, because alcohol is seen as depressant, which depresses all the center, including gag reflex, cough reflex and all. So cafe coronary syndrome, also known as banana syndrome in my words, है ना? Good. Manak Datta, Rakesh, Alka Kumari, Advitesh. Good answer. All answering. That's great. That's great. So डरना नहीं है, ठीक है. जो डर गया समझो मर गया. Very famous dialogue है. Can you tell me the name of the movie? This dialogue is there, no? जो डर गया समझो मर गया. Very famous movie है. Can anyone try? What was the name of the movie? My favorite movie है and favorite dialogue भी है. बताओ कौन सा movie है? एग्जाम में नहीं आता ये क्वेश्चन, याद रखना, ठीक है. चलो टाइप मेनक दत्ता, अद्वितेश, अलका कुमारी, शोले. मेनक दत्ता is telling beta शोले, great man, great. So you are good in cinema questions also. बढ़िया, बहुत बढ़िया. And the last question today, last question of the day. Look at this. Russell viper, the venom causes severe local reaction. You know, in viper death, the local reactions are very maximum, especially necrosis of the limb, very common, kidney failure, because of hemoglobinuria, parotid enlargement, hematuria, very common. Why all this occurs? That is the question. Option A है enzymes, option B है bungarotoxin, option D tetrodotoxin, and also myotoxin. Very interesting question. So can anyone try? See, whenever tetrodotoxin, that is basically puffer fish, myotoxin, sea snake, bungarotoxin, that is basically cobra and kite. So answer hai, that is vipers. So they are basically hemotoxic because around 70 to 90% of this venom that consists of enzymes. So this enzyme, they cause breakdown of the tissues, the membrane, so which causes usually acute renal failure and also kidney failure. So usually death occurs in 3 to 4 days. Treatment है anti-snake venom. Anti-snake venom is the, ठीक है, Rakesh, good, Alka Kumari, Manak Datta, many answered. So this is how we discussed 10 questions. So what is our score, guys? What is the final score of today's test? I think today Rakesh, Manak, and we have, I think today Alka Kumari and Advi. So what is your score? Score क्या है बताओ? Manak Datta got 8. That's great. And Alka Kumari got 6. And Rakesh, what is your score? Rakesh got 9. And the last one. So thank you all. So this is about the today's session. We'll come up with some more important session, some more important cases like this in upcoming classes. So one of the most important case today, the case of the day, is positional asphyxia. ठीक है? Abnormal position can lead to death. One example here is the fall due to very high alcohol intake in a mud. So he was unable to get up from that position. Okay? So that completes today's the one-shot series. We'll come up with some more interesting cases, some more important video-based questions in upcoming days. And any suggestion about the lecture, whether it is really good or amazing or it is interesting, or about the speed, whether it is very slow or very fast, you can type few words in the chat box. And if you want any topic, extra topic to be discussed in the class, also you can suggest me in the chat box.